Hey, let's talk about aortic aneurysm. So before that, let's know what is aorta. Aorta is the main blood vessel of body, which originates at the level of exit point from the heart. It receives blood from the heart and distributes to all organs by different branches. Through its branches, it supplies to blood to brain, to hands, to liver, spleen, stomach, intestine, kidney, and to legs. Now, coming to what is aneurysm? So, a normal blood vessel is a straight tube where the blood flows in a straight line. Uh, Now, sometime the blood vessel can get occluded, hampering the blood flow to distal portion, which is called occlusive disease. Whereas sometimes this blood vessel can actually balloon up. It gets weak at some areas and it can balloon up, and there's a risk of rupture. And when it ruptures, it can cause massive bleeding. So, this ballooning is called aneurysm. Now, aneurysm can expand with time. So, aneurysm can occur in any blood vessel, but most common is aorta at the abdominal level. As the size of aneurysm increases, the chance of it to rupture also increases. Um, so, once this rupture occurs, it causes severe bleeding, which can lead to death in no time. Almost 9 out of 10 patients where aortic aneurysm ruptures, patient die even before reaching to hospital. So when this size of the aneurysm, when it grows beyond a certain size, and researchers have shown that when it is more than 5 centimeter in abdominal aorta area, risk of rupture increases too much and elective repair of this aneurysm is recommended. A simple ultrasound abdomen can help to identify this aneurysm before it ruptures. So it's recommended in men above 65 years age who have ever smoked or consumed tobacco in any form. Uh, it's less common in female. So thereby the routine screening is not recommended in females, but above 65 person who has smoked, it's indicated. If identified as small aneurysm, which is less than 5 centimeter, it must be followed by serial ultrasounds to look for its growth. And once it grows beyond 5 to 5.5 centimeter, it needs selective repair. Now, coming to repair, aneurysm, how can aneurysm can be repaired? There are two ways: either by the open surgery doing a bypass or by endovascular. Now, open aneurysm repair, for that, a cut is made on your tummy, and then we reach by dissecting several areas. We reach to the aorta, and we find out where the aneurysm is. We clamp it from above the aneurysm and below the aneurysm so that there is no blood is leaking when we are operating. And then we, once after opening, we sew an artificial plastic graft. Okay, it's called PTFE or sometimes Dacron. These are the artificial blood vessels. We sew artificial blood graft to the healthy to healthy area so that there is no flow in the aneurysm. Now, another is endovascular aneurysm repair, which is also called EVAR. Here, in place of making a cut in abdomen, we make a small cut in the groin near the upper thigh area. From here, we first take a wire under X-ray guidance. We first take a wire across this into aorta. Then we take a stent on top of this wire. While we do angiogram, we position our stent in at the level of aneurysm, and then once we open the stent, the blood starts flowing through the stents to distal areas, and there is no flow in the aneurysm. And then over a period of time, this aneurysm decreases in size. So, what are the pros cons of open and endovascular repair? Coming to cost, in India, a typical open repair costs somewhere around 2.5 to 3 lakh rupees, whereas endovascular repair costs anywhere between 5 to 7 lakhs. Hospital admission is required long in open repair, which is around 6 to 7 days, whereas endovascular repair only 1 to 2 days of hospital stay is required. The risks: obviously, open repair includes major surgery, major cutting, more ICU stay, and under anesthesia. So it is more invasive. There's more bleeding involved. There's more abdominal related complications, higher risk of heart attack, renal failure, especially in elderly patients. Whereas endovascular repair has small incision and there are overall less risk involved. Coming to durability, open repair is definitely more durable, and therefore it doesn't need, once post after surgery 1 month is over, no major regular follow up is needed. Whereas durability is less of endovascular repair and it needs regular CT scans. So overall, the open repair is more suitable for younger patients who are otherwise not sick, who can undergo a major surgery, whose bodies are fit enough to undergo big anesthesia and who can sustain it for long. And because they are younger, they have a long life to live. So they need something which is more durable, and not very often they need every 6 months or 1 year CT scan. Whereas if the aneurysm is found in elderly, say around 75 years male or 80 years male, who otherwise are very high risk candidate for the anesthesia and whose body cannot take the major surgery, there the endovascular repair is very suitable. Um, and also one major decider factor also comes here, the cost.